Hello, listeners. I'm Dr. Rod Rocconi, the interim director of the Mitchell Cancer Institute. We're very excited about the first season of The Cancerin' Show. We hope you find this podcast informational, hopeful, and of course, we hope that you enjoy it.
You never want to hear the word cancer. My father and my uncle both passed away of pancreatic cancer within 3 months of each other, actually. Why did we not know about this lethal cancer? What is there to know? And I went home that night, Googled pancreatic cancer, and I sat on my sofa by myself and just cried. It's devastating. So really, by the time you have symptoms...
Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancerin' Show.
Hello, everybody. This is Mike Finan. I am a senior gynecologic oncologist and professor of interdisciplinary clinical oncology at the USA Mitchell Cancer Institute here in Mobile, Alabama. And I'm very excited to kick off this series of The Cancerin' Show. And with that said, I am not the host of this show, but I'd like to have our host introduce herself.
Hi, I am Dr. Jennifer Young-Pierce. I am a GYN oncologist at the Mitchell Cancer Institute. I also serve as the program leader for our cancer control and prevention group.
Tell me a little bit about yourself, Jennifer. Tell me about your journey to go to medical school. What made you decide to go become a physician?
I was not one of those kids who grew up thinking I was going to be a doctor every day of childhood. I knew that I wanted to do science and I loved to do problem solving. So a high school teacher convinced me to do engineering school. So I went to the University of Virginia to the School of Engineering and was in chemical engineering. But after one very hot summer working in a chemical plant, I decided that medical school was the future for me.
Absolutely.
And I went from there on to the Medical University of South Carolina.
Outstanding. And tell me a little bit about what your journey to become a gynecologic oncologist. That's quite a specialty.
So GYN oncology is incredibly unique in the cancer realm. We are the only doctors who do both the chemotherapy and the surgery for women's cancers. So throughout my medical journey, I always had an interest in women's health and cancer prevention. And that naturally led to a subspecialty of OBGYN from medical school. And within that field, really found GYN oncology encompassed everything that I was looking for in patient care. I wanted to care for patients when they were well and when they were very sick or even dying. And I wanted to make sure that I could follow somebody from their entire cancer journey, from diagnosis to survival or even to passing.
Absolutely. Throughout your journey, there must have been one single moment, like an aha moment, where something just clicked and had a giant impact on your journey. What was that moment?
There was a patient, and she and I were about the same age. Forgive me if I tear up. She had a mass on her ovaries, and she got married, but delayed her honeymoon to have surgery. Unfortunately, it was an ovarian cancer, and she lived the last 8 weeks of her life in the hospital. I sat on her bed every day. We looked at her wedding pictures when they came in and watched that life slip away. And I was the intern, so I wasn't allowed to tell her that she was dying. And I wasn't allowed to make the decisions that would have gotten her out of the hospital instead of still undergoing treatments that I knew would keep her in the hospital. That was the moment that I wanted to do this, and I wanted to do it better.
Wow. Such a touching story and powerful. The title of this show is The Cancerin' Show, but I've never heard that word before. Did you make that up?
I think we did make it up.
Tell me the truth. You made it up.
I would tell you the truth that it wasn't me, but a brilliant set of people who are part of the show.
How would you define cancering?
When I hear it, it sounds like a verb. It's not cancer, the noun. It's cancering, being diagnosed with cancer, being affected by cancer, being a part of a family that is affected by cancer or a community that is affected by cancer. I think about groups of people who are surrounding one particular family, and all of those people are cancering in that moment.
It really affects everyone, doesn't it?
It affects everyone from the person who cares for you in the MCI as much as it affects the person who cares for you at your school or your workplace or at home. I think we're going to think about every aspect of that cancering journey from people trying to prevent cancer in their families all the way to families that are coping with an imminent loss. And we want people to think of cancer as not just a moment in time, a moment of being better than you were before, living better, turning cancer from a negative into a positive for not just the patient, but the whole community.
Absolutely. And many describe it as a struggle or a rage, battle. What are your thoughts about the term battle?
I hate the word battle as describes cancer. I understand where it comes from. I know that getting one's mind around a very intensive set of treatments really requires that kind of mental toughness and the idea that you're going to get through this, even though it's going to be really hard. I totally get that. But a battle implies that there's a beginning, a middle, and an end. And too often, patients have been struggling with symptoms before they're ever diagnosed. And that just because their cancer treatment is over, a lot of even friends and family say, great, now you're better. And cancer patients will tell you that they're still cancering,
right,
that they're still symptomatic, that there are side
right,
effects you can't see, that they are actively trying to cover up so that you feel better. And we want those patients to have a word for that in their journey.
Let's also add that cancering also involves science, technology, and most importantly, hope.
Absolutely. There is a part of cancering that is always moving towards the next thing, whether that is the next invention, the next device, the next idea of how to treat patients better. I think a lot of people think of research as pipettes in a lab and two chemicals being mixed together, but every day at MCI, patients are undergoing clinical trials, which is a new drug being introduced into their bodies. But there's also research on how's the best way to treat nausea, how's the best way to deal with depression associated with cancer. These aren't just new drugs. We're having new ways of doing things, new ideas about how to incorporate the family and that talks about death and dying into everyday cancer care.
Absolutely. And then how did you arrive at the Mitchell Cancer Institute, of all places, in Mobile, Alabama?
So I got super lucky. I had traveled to Africa as a resident and worked with a gynecologic there who was South African, and she was screening women in shipping containers. And I thought it was just amazing what she was accomplishing in these shanty towns outside of Cape Town. And I asked her how I could be more like her. And she said, well, you need a master's in public health. So check, I did that while I was at the University of Virginia. And then second, I needed to work in my own community. So I took that advice. And when I had finished my training, went back to South Carolina. For me, as I did the work in South Carolina, I felt like we had good momentum, but there was an opportunity to come to Mobile where our needs are even greater. And it was an opportunity for me to expand from just looking at cervical cancer prevention to really focusing on all cancer prevention. And unfortunately, Lower Alabama and the Southeast in general have some astronomical cancer rates. And there's so many opportunities to care for people better, to survive longer, and to prevent the cancer from even happening.
That is absolutely incredible. What drives you every day to help patients with cancer? What is that spark that keeps you going?
It's the patients themselves. I usually spend a lot of time with my patients early on in their diagnosis and treatment to learn as much as I can about them, whether that's someone trying to make it to a wedding or to become a Mardi Gras queen or to see a child graduate from high school. So their goals become my goals, whether it is how do we get a wig so that you look good and feel good? How do we manage symptoms of cancer treatment? How do we get you through a surgery and recovered in time to be at that special event?
Those are all so important, and that's what keeps me going as well. I tell you, those life moments, they're critical. And tell me this, cancer is such a serious disease. It's life-threatening. In many cases, it's curable, but in many cases, it's a death sentence. Have you ever seen it have a positive impact on patients or families?
Absolutely more positive than negative. Every patient that I've encountered has said, I wouldn't want to get cancer again, but because I've had cancer, I live a little bit better. I love a little bit stronger. I make each day mean something in a way that many of us just don't appreciate how close and how short time can be.
Oh, and that is so true, so true. I've seen it many times myself that cancer truly has a positive impact on not only a patient, but also their family.
Right here, we're going to take a short break in our conversation. You are about to hear our innovation segment.
on this and future shows, we're going to take a break so you can hear directly from the Mitchell Cancer Center cancer researchers on the latest breakthroughs in diagnosis and treatment.
My name is Marie Migaud, and I am from France. I am not a medical doctor. I am a research doctor. So I am a chemist, so very different from most researchers here at MCI. My occupation is to better understand the chemistry behind the disease. So we make small molecules so that biologists can use those small molecules to test cells' behavior. And this then informs on how we can better stop cancer. Our interest is in B vitamins. So B vitamins are small molecules that enzymes use to do things. While B vitamins are very common, we actually know very little as to their true roles in health and disease. So we are developing chemical tools, some molecules, to probe that system. What happens if you have too much of one? What happens if you have too little of another? What are the consequences? And what are the consequences on the cells that might be cancerous cells or cells that have propensity to become cancerous? So we are looking at the nutritional aspect of that chemistry. The importance of B vitamin is we need them, but we do not know when we need them. And certainly in disease, in the case of cancer, on some occasion, we do not have enough because of the treatment we receive. But supplementation, while might improve the quality of life, might actually be detrimental to the treatment. So it's understanding when and how we need, or how much of we need of those vitamins, so that the clinician can actually put the treatment in place along with recommendation as to, yes, you can take a vitamin, no, you shouldn't be taking this vitamin, at least not this moment in time. So my work at MCI is really to improve on the current treatment that the physicians have in place and inform them as to when and whether a patient requires some changes to their nutritional plan or not. It's how do you refine? We talk about personalized medicine, but because everybody's body and metabolism is different, we want to know what makes the individual tick, and therefore how we can best supply and provide the right vitamins to that individual so the best treatment and outcome can be achieved. Every morning I like to get through those MCI doors and see the patients in the room, even though I wish they were not there because then they would be healthy. But by seeing them there, it gives me a good motivation to do some good work during the day.
It's so fun to hear all the amazing work going on at MCI, and I'm so excited to hear these segments for each show, and I know you will be also. But now let's get back to our conversation.
So JYP, what would you like the listeners to get out of this show?
We're two doctors speaking right now, but there's going to be a lot of voices on the Cancering Show. We want to bring in the patient voices, the caretaker voices, the nurses, the researchers, everybody together who's working maybe on one case or on every case at MCI at the same time, so that you know that you're not alone, that this is a team sport. We're all partners. You know, in previous days, patients thought that they received the edict of what their treatment would be from on high. And in this day and age, it's a partnership.
We have so many people involved, like genetics counselors and nutritionists and patient navigators, social workers, financial counselors. It's a whole team of people, isn't it, that cares for our patients?
Exactly. And we're going to bring them all here to the show so that you as the listener can understand better how to help and support your family members and how to understand how to get access to these resources as well.
What do you think you'll learn from this experience, these 12 segments? What will you get out of it?
Well, I think I'm very subspecialty focused in terms of my knowledge of research in particular, and I'm super excited to learn about the research at the Mitchell Cancer Institute in other cancers, pancreatic cancer, colorectal cancer, breast cancer, and even more so, how does this play into that team approach for these other diseases?
So JYP, we've learned a lot about your the professional side of your life. Tell us and tell the audience a little bit about yourself when you get home and take the white coat off. What's your personal life like?
I am lucky to be greeted by a tall and handsome husband and 2 little girls, ages 6 and 4, in kindergarten and pre-K. So there's usually a lot of artwork and tiny toys and a doll, possibly a doll in the mouth of our golden retriever, Ellie.
I was going to ask about the dog, yes.
So, yes, it's quite an enthusiastic greeting when I walk in the door.
And what do you like to do outside of work? What are some of the things you and Chris and the family like to do?
We have a great group of neighbors and neighborhood little girls. We call them the Blonde Mafia. They're all between ages 4 and 6, so they all run around together. And as moms, we get together frequently. We also frequent gardener and would love to be a better chef, but I am a struggling cook at the moment.
But at least you're not just opening a can of beans and heating up some soup.
Luckily, we do a little bit better than that.
Right.
But
good.
Mostly on my husband's part.
But it sounds like it's centered around family and friends, which is incredible. That's
Absolutely.
A great life. But I just want to tell you, I am just absolutely thrilled about this series, and I'm very, very excited to hear the next 12 episodes. It's going to be a great journey, and I'm very, very excited. So thanks again.
Thank you. I'm really looking forward to it.
Thanks, everyone, for listening to The Cancering Show with JYP, Dr. Jennifer Young-Pierce. Please subscribe, rate, and review this show on iTunes and anywhere else you listen to your favorite podcasts. Want us to deliver The Cancering Show to your email inbox? Contact us at cancering.com, and we can make sure you never miss an episode. We would love to know what you think about the show, or if you have any suggestions on topics you would like to hear. You can reach out to us on Facebook, Twitter, and cancering.com. Till next time, be healthy, happy, and always thriving.
This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.